Well, hey y'all. I guess haven't been on the YouTube in a while. I haven't really put out any videos. I've been dealing with some medical stuff. Still not over it. Not sure what's going to come. I got another doctor appointment this Tuesday for my legs. I just thought I'd give a little update of kind of what's been going on. There may be a video. There's probably going to be a video right before this, the Chungus burger. Anyway, it's just some stupid little thing I thought of. Yeah, I mean, I made a video back, a couple videos back, a while back. February, I went in the hospital for a heart cath and stress test. I didn't get any stents or any blockages or whatever. I just thought I was having a heart attack. It wound up being just anxiety, panic attack or whatever. But so they kind of upped my meds some and stuff like that. But so I've been doing a little bit better on that, but I was doing but anyway, I wound up getting a sinus infection a month or so after that, and then I went to a bad cough, and they put me on some strong antibiotics. A lot of times strong antibiotics mess up my bowels and system or whatever, and I've had a problem with hemorrhoids, I don't know, since my early 20s. Most of the time it's from antibiotics. It would flare up. Usually Preparation H or whatever, over-the-counter stuff would clear it up in a week or so, and I'd be good to go for however long, I wound up getting a really bad case of it, and it was really hurting. I think it was from the straining. I was really coughing really bad, and I'm not sure what else but caused it, but whatever. But the antibiotics plus the coughing, I think, I don't know, aggravated or whatever. But anyway, I finally got over the sinus infection and the cough, but I still had the bad hemorrhoid problem. I went out and mowed one afternoon, and the hemorrhoids were bothering me, and I don't know what really happened, but the next day I woke up, it was a Saturday morning, and man, it was, my hole was on fire down there. I mean, it felt like somebody had a match or a hot poker sticking in me or something, man, and I was trying different stuff to see if it helped, but nothing. I mean, it just made it worse. I mean, everything I put in there just made it burn even more, and which I found out later, most stuff has alcohol in it or something like that. So, which is fine for a hemorrhoid, I guess, but it wound up being, I finally just couldn't take it anymore. I went to the emergency room, and the doctor looked in there, and he didn't see any hemorrhoids hanging out. They call it a prolapsing hemorrhoid or something like that, and anyway, but he did see a spot. He said it was really red. It looked like maybe something, and it had busted or something. I assumed like a blister, and he said that he was going to give me some more antibiotics and some pain pills. Anyway, and prescribed me some kind of first it's some kind of foam stuff, and I couldn't find it anywhere, so they changed it to basically what do they call that stuff? Anyway, it's just a cream, kind of like Preparation H, but it's made to reduce the swelling better or whatever. Anyway, but I tried that, and it was like, oh God, it was just killing me. I kept trying it for a couple of days, and I mean, I was literally I couldn't sleep, I couldn't eat, I couldn't do nothing. It was just killing me. And finally, I called my doctor. I think it was that Monday, and I went in. They couldn't see me Monday, so I had to go in Tuesday, and she looked, and she said she still see some redness and whatever. Anyway, I had been reading some stuff and about fissures, anal fissures. Basically, it's kind of like a tear or something in your anal. I don't know what your sphincter muscle or whatever there. Basically your hole, and it's really painful. I remember my mama had one years ago, and back years before she passed away, but she, I remember she suffered from it. I can't remember what they did about it. She didn't have any surgery or anything, but I don't know if she just kept suffering with it or what, or if it finally went away. But anyway, they said that's probably what it was, but they wasn't for sure. So they said just keep trying to take the stuff, and and I tried it. If they couldn't, they would have to line me up with a gastroenterology clinic or whatever it's called. Somebody goes in with a scope and looks at your thing. And by Thursday, I called them. I said, I can't take this anymore. I said, y'all going to have to do something. Well, She said, I'm gonna tell you, it's gonna be probably a while. It probably maybe 2 or 3 weeks before they even call you. So I was like, great. But I finally found. I was trying to find something. I got to thinking, if it was that's probably, it's like a paper cut. You put alcohol or something like that on it, it just burns like fire. Eventually it kind of goes away, but this thing was just, it was killing me. And finally I looked into like the zinc oxide stuff, like Boudreaux's, butt paste, stuff like that, and it has nothing in there, any stuff like that. So any kind of acidy stuff, stearic acid and crap like that, but all that other stuff has it all in there. And so I had some of that. It was old, but I tried it, and it was like, it actually was the best relief I had. Now, I also looked into a sitz bath, which is basically a thing. I was trying to sit in the tub with Epsom salts, but it's so hard to get it up and down and stuff like that. And it was, you had to fill up the bathtub with like gallons of water, and I had to leave a whole bunch of freaking Epsom salts to make it worthwhile and all that stuff. And so finally, I just ordered me a little thing, and I made a video on this a while back, singing, about a hemorrhoid, whatever. You can look it up, whatever. It ain't that far back because I haven't made any videos. But you soak on it, you fill it with warm water. You can put stuff in there like Epsom salt, and you can soak on it or whatever. It makes it a lot easier. Well, I started doing that plus the zinc oxide. I actually bought some of the Boudreaux's butt paste stuff, and all that was kind of helping. I was just basically shoving it up in there and rubbing it around. Well, finally, the gastro place called me after almost exactly 3 weeks, and had to wait another week. No, they called me at 2 weeks, I think, and then I had to wait another week to go in. But I finally got in, and the doctor, he spread it open. Of course, that about killed me when he did that, because it was actually, I think it may have been starting to kind of heal a little bit. I'm not sure, but it was still killing me. But he spread it open and looked, and he's like, I was like, man, that's killing me. So he come to the conclusion it was probably, because he didn't see a hemorrhoid or anything either. So he says probably as a fissure. So he prescribed this cream. You have to get it from a pharmacy that they call it a compound. It's a compound pharmacy where it's not like a regular pharmacy. They mix it up. They mix different stuff up or whatever. Anyway, it has some kind of stuff in there. They actually use it for hearts or something. It's supposed to help reduce swelling or something like that. Anyway, so the theory behind it is you put it inside there, and you go up to about your finger, knuckle, or first knuckle, whatever, and you rub it around. And the theory behind, from what I read, is it's supposed to, after a little bit, it loosens the muscle to where when you go to the bathroom, it will be easier for the poop to come out. So it lets the fissure heal, because basically every time you take a crap, it reopens it again. I mean, of course, you got to poop every day, or like me, sometimes I go 2 or 3 times a day sometimes, It would just reopen it, I guess. But I finally went in. They want to do a thing with a colonoscopy. I had one done about 5 years ago. They want to do another one anyway. So I did that to clean out. Oh, it was horrible, all this stuff, Went in. They did a colonoscopy. He said he removed like 16 little tiny polyps. They wasn't nothing, but he said it did look like I had a fissure and some a hemorrhoid or two or something in there. And so he prescribed a different kind of cream. It says nitroglycerin, and it is actually nitroglycerin cream or something like that. I put that stuff in there, and it burned like fire. I couldn't use it, and I called them, and I said, this is killing me, with this stuff. And so they're like, oh, we never heard of that before. But so they re-prescribed the other stuff and put me back on that stuff. And then they said, we're going to have to send you to a surgeon, because apparently a surgeon is the only thing that can do it. Apparently years ago, you went to a proctologist and they pretty much handled everything, I guess. But now you got to go through 100 different people, 100 freaking specialists. They all got to get their money. But so that took a while, for several weeks before they ever called me. In the meantime, I just kept using that stuff, and I was getting by sitting on the thing all the time. It It's just it just went on for months. And back in, I'm not sure, I think it was June or July, whatever. I've had flare-ups of cellulitis in my legs. I don't know if y'all know what that is, but it's kind of like an infection that gets in your skin. And I got it the first time when I was 30-something. I was actually working on something. I was pushing a jack, trying to push it. I slipped off and it hit me in the shin. And the next day, it was a little red spot. The next day, it was about this big. I went to the doctor. They put me on antibiotics, and it went away. But it actually had spread all the way up, about halfway up my leg. I mean, to my knee, about halfway up my knee. And then when it cleared up the infection, it left my leg looking weird. No hair would grow. Basically, the infection almost, your skin kind of looks like an orange peel, like a peeling, like the outside of an orange, dimple and whatever. And because it's basically swells, I don't know what all it does, but anyway, I don't know. And then that finally went away, but like I said, my legs stayed kind of discolored, and which you can look it up and you can see other people have had this too. But about a year later or something, me and my son, we were throwing a baseball and it hit me in my other leg. It started spreading, but it did the same thing. But I went to the doctor a lot quicker and got on antibiotics a lot quicker. So it didn't do as bad that time. But over the years, over the next, I don't know how many years, for no reason at all, it would just get red and hot down there, the leg. Use this one leg or the other. And I've had it, this was probably about the 4th time in my left leg, and probably the 3rd time in my right, but this time it did both legs at the same time. The only thing I'd done, I'd bought a new pair of tennis shoes, and I had laced them up, tight or whatever, and wore them to Walmart or something. And when I got back, my ankles were hurting kind of, and I thought, man, I should have tied those laces up so high up, whatever. And usually I wear work boots, and usually I keep it kind of loose, only I don't lace up all the way. But anyway, but I didn't think I'd be no problem because it's over tennis shoes. But the next day is when it started, looking infected or whatever. And of course, I knew what it looked like, and it started spreading and all that stuff. So I went to the doctor. They put me on antibiotics. That went on for a while. Kept going back because it would never clear up. I tried something called an Una boot, which is a wrap thing. I put that on 24 hours. It didn't do no good. It made it worse, it seemed like. Couldn't get nothing to get rid of the infection. Well, then I was on I think I was on my 3rd round of 10-day antibiotics from the doctor. And I don't remember which one it was called, but they told me if I had ever run a fever, and I looked it up too, if you started running fever, over 100.4 or whatever, you needed to get to a doctor because it could be going into your bloodstream, getting sepsis, and you could die. So one night, I had been running no fever, and also one night it started just spiking up, So, and I couldn't get it to come down after a few hours. It wouldn't come down, and so I went to the emergency room that night, and they put me on intravenous antibiotics. The next day, they didn't ever move me to a room. They were booked up, whatever, I don't know. They just kind of shoved me back in the back room for about, 12 hours or something. And finally, the doctor comes in, and he said he thinks you had some kind of blah, blah, blah cellulitis stuff. I'm like, yeah, I know. And he's like, I'm gonna give you some stronger antibiotics. And it was actually the same antibiotics that gave me the hemorrhoid problem originally. But there was one of the strongest antibiotics I guess you can get for skins and whatever, different kinds of stuff. But so I put me on that, and like I said, finally after it started getting better, and the infection part of it, my legs still look horrible and they still hurt. I was having this weird thing where, it feels like needles. It was really bad. If I got up and tried to walk, I could literally hardly walk. My ankles, I couldn't walk. I had to just basically wear like house shoes and stuff. And of course I was trying to work, and it was miserable. And then I had my butt problem, dealing with that. I was still waiting for the surgery thing and whatever. Finally it started, clearing up, and eventually the needle thing has gotten a little better. They still hurt, and my left leg is worse, and my foot kind of swells up, especially my heel. It'll go to, I don't know if it swells or what, but it goes where I can't like walk. I do okay as long as I'm wearing shoes, but like without shoes on, just socks or something, it like hurts. But the needle part is a lot better and stuff. But there's still something. But while I was in the hospital, oh I forgot that. While I was in the hospital for the infection in my leg, I'd already had a scheduled. They'd already scheduled through my regular doctor a kind of like an ultrasound sonogram thing or something. They basically want to check and see if you have any blockages. And so when they let me out, got me off the IV, I went down there and did that, and it come back. I didn't have any blockages. And I don't know why. I got varicose veins pretty bad, especially in my right leg. But anyway, they sent it to my regular doctor. Well, I talked to them a few days later because I wanted to know what the results were, and they said, well, it don't show no blockages, but she wanted to go ahead and send it over to a cardiovascular doctor. They deal with veins and stuff. Now, I'd had the heart cath and stuff, so I knew my heart was okay, and so this one has to do with your veins and stuff. And he said, look, going to send that over to him, the results, and see what they say. Well, like I said, I was still dealing with the hemorrhoid thing. They finally scheduled me for surgery. I finally back. It'll be Monday. This Monday, which is the 18th or something, whatever, of September. It'll be 3 weeks since I had the surgery. I went in and they. I don't know. They do what's called a lateral sphincterotomy or something like that, and a hemorrhoidectomy, I think is how you pronounce it. Basically, after they say they remove a hemorrhoid, and then the lateral sphincterotomy. Basically, from what I can understand, they make an incision on my left side because the fissure was on my right side. If I'm looking, like my right. Okay, so they made an incision on the left side, and they go in there, and they cut the sphincter muscle somehow to make it to where when you poop, it opens bigger without it lets a bigger turd come out. I'm just gonna be critical. Obviously, it lets a bigger turd out without doing anything, so that the fissure can heal now, and it has like a 95% effective rate or whatever. And so they did that, sent me home with some like 5 days of pain pills, Narco 10, which is pretty strong, but they really didn't work. They worked for about 2 or 3 hours, and then you only take them every 6 hours, and they only gave me 5 days worth. And I ain't kidding you. This has been some of the worst pain. They also when you leave, they basically put I don't know. I guess it's like a tampon. They put that up inside your booty hole and to soak up the blood or whatever. And they also put like a big old, big square thing across my whole butt, taped it on. And they said you take that off and try to leave the other thing in till the next day. Try to leave it in 24 hours if you can. And well, I finally took the big thing off after that night. I'd gotten home like 1 o'clock or something, and finally during the night I took off that thing, and I decided I couldn't stand the thing being up there. And it had been, I don't know, like 19 hours or something like that when I finally pulled it out. But that was the hardest thing I've probably ever done in my life, just about. As far as I just had surgery up in there, and 2 surgeries actually, the hemorrhoid thing and this, and the sphincterotomy, lateral sphincterotomy thing. Basically, it says you can sit in water or whatever, and basically, I guess it kind of helps you'll soak into it and help soften it, so you can pull it out. I sat on the sitz bath thing, and it has a little bubble with things. I kept trying to bubble it and try to get it to, and I tried pulling on it. It had a little string. I was afraid that spring was going to break, and I didn't know what I was going to do, but I was pulling and pulling and pulling. Couldn't get it to move, so I kept soaking. So after about 20 minutes or 25 minutes or something, I finally I got it. And so I wrapped that thing around my finger, that string, and I just tugged literally as hard as I could tug on that thing, and it started coming, it started moving, and it finally popped out, and that thing was about probably that big around and about that long, and it was very nasty, bloody, poopy looking. I don't know, it looked like a big bloody turd, that's what it looked like, but and so it plopped out, and of course I felt better just getting that out, but it was very painful and stuff. And anyway, after that, I didn't go to the bathroom for several days, like 4 or 5 days after that. I don't know if it was just I could go. I don't know if I think they give you an enema or something before they do the thing, because I didn't clean myself out, but they said that they would do it. So apparently they gave you an enema. I don't know what they do, but apparently they do that, and they have you bent over, apparently like a table or something, to where your booty's in the air. This is what they told me, and to do the surgery or whatever. And anyway, so I got that out, and so now it's been 3 weeks, and I've been dealing with it. I've been soaking, whatever. I didn't work for a whole week. I didn't do nothing. I basically just laid on my. And that was another thing. For years I've been sleeping mostly in a recliner because of my back, and had sleep apnea. They didn't really do a sleep test on me, but my ex-wife now, but she had said I had it, and when I was laid down, well, I started sleeping, and because literally I couldn't drive 5 minutes and I'd be wanting to go to sleep, and so after I started sleeping like that in a recliner, my sleep got better, my back got better. I went on going to a chiropractor for a long time, but they finally got better. But so I had to sleep basically in this bed for 3 weeks, almost 3 weeks, and for over a week it was just flat on my back. I couldn't. And I basically just get up and go pee and go to the bathroom, and that was about it, And I started getting this numbness, and that's the only thing I can think of it had to do with is around my midsection, right there below my boobs and above my waist, and it's still there. And I've been having a lot of my back has been hurting quite a bit. So I finally, a couple of nights ago, I have got to quit trying to lay in this bed, and so I went back to trying to sleep in a recliner, and I've been sleeping in that pretty good. And it's still rough to sit, but I'm sitting now, and I've been. I went back to the doctor last week, first of last week. Went back, and they said it looked like I had diaper rash. They said because basically I wasn't putting anything down there, and I guess basically it left like a bump in there, and I guess as I was walking or moving or whatever, it would rub, and it's causing redness down there and stuff. Well, so I started using the Desitin stuff again, Boutros or whatever, and it's finally for a couple of days it was really hurting because it really got bad there for a couple of days, but I kept using that stuff, and it's gotten a lot better, and so it seems like it's gotten better. It seems like it's a lot easier to go to the bathroom and stuff like that. But so I'm hoping that'll be. They said it could take anywhere. They said you will be in a lot of pain for 2 to 3 weeks, and then it'll gradually start getting better, and it could take up to a couple months to fully heal. So I'm hoping, maybe whatever. But now I've got a thing to go to this cardiovascular guy this coming Tuesday to see what's going on with my legs. I don't know what they're going to do about that. And so I've just been on pretty crappy playing. I can't sit, edit. I haven't wanted to film nothing. It was me talking or whatever. But I did a couple of videos with just over the past several months of just different stuff. My dad playing harmonica, some bug stuff or whatever. I don't know. Just some stuff. Some of it was just stuff I'd already filmed before, and I just edited it and put it out in shorts videos usually. But I just wanted to make a video and explain kind of where I've been and what's kind of going on. I really don't know what's going to happen. And I said I'm getting better with the butt thing. Apparently, the leg thing is better, but I don't know what they're going to want to do. I don't know if they're going to want to do some kind of surgery. I would think, since they say I don't have any blockages, but they may want to do some kind of I don't know, wear something, therapy, I don't know, whatever, but I'll make another video with whatever, whenever that happens or whatever. But I think that's about all I want to talk about, and so I'm going to get off here. And I appreciate y'all, if y'all watching this and hanging with me, whatever. I'm getting kind of dark. Well, it's getting darker in here, but I probably should have put some more lighting in here. But I didn't feel like really setting all this up. I just put the camera here, and I'm just sitting on my bed. Hopefully, I'll get back on a schedule of every week or so. I'm hoping, but it just kind of just depends on what happens. So anyway, thanks for hanging with me, and like the video, subscribe, all that junk. Hit the thanks button, or that thing will, it gives you a little bit of money, but it's only like once a month or whatever. But I mean, whenever they get $100 worth of whatever in there, but it would help out. Any little bit will help if you want to do that. I'm not asking, but just if you want to do that, it'll help me out. But my family's been helping me a lot, and they've been great. I mean, food. Hauling me back to my ex-wife. She actually hauls me back and forth to the doctor a lot because I haven't been able to drive, and my son goes with me, and he takes me, and it's been been doing all that, and they've been feeding me and helping me with bills some, and just all kinds of stuff. My dad's almost 94, but he's been trying to help me when he can, and so it's been great. My brother-in-law mowing my yard and stuff. So, I can't tell you how much I appreciate all that stuff. But anyway, I'm gonna get off here before I start tearing up, and I will talk to you, and hopefully in the next video. See you later. Bye bye.
Living life every day, late at night, not okay. All I want, and I pray, all I need are some better days.